Hi, my name is Ann. I'm a physical therapist at Meridian Park Hospital, and I'm here today to talk to you about your physical therapy before your surgery, while you're in the hospital, and when you go home. After this, you will have a video on occupational therapy. And after that, you will have the opportunity to click on a link to watch management and treatment of your pain. Don't forget that this is a video. You can stop it, pause it at any time to review the information. And also don't forget to write your questions down, and we will go over those when you're in the hospital. There is a section in your electronic version of the notebook about hip or knee anatomy. Your surgeon may have gone over that with you already, as well as the type of hip or knee that you are getting. If you have any additional questions, please ask the surgeon. You are going to have physical therapy up to twice a day. Let me explain how that will look. On the day of surgery, you will have physical therapy in the afternoon. We actually call that post-operative day 0 because it's not a day after surgery yet. Some of you may go home the afternoon of surgery. For those of you remaining overnight in the hospital, you will have physical therapy the next morning. The physical therapist will teach strengthening and flexibility exercises, work on your mobility, including getting in and out of bed, transfers, and walking. Also, how to go up and down stairs and get in and out of a car. A lot of patients are worried about stairs, whether you live in a 2-story home or need to go up steps to get into your home. We will make sure you can do the stairs safely before you leave the hospital. So, what to expect? At Meridian Park, we really pride ourselves in having a team approach. Your team not only includes your doctor, nurse, physical therapist, occupational therapist, and orthopedic care coordinator, but also some of the most important people on your team are your family and friends that will help you after surgery. As I mentioned before, the physical therapist will come see you the afternoon of surgery to get you out of bed. A few things that might limit this would be nausea, pain, or blood pressure. It's common to see the low blood pressure after surgery, which can cause lightheadedness or dizziness when you stand up. That may determine whether or not we can walk with you. As the orthopedic care coordinator mentioned, it is normal to have pain. I like to highlight this slide because it will give you some strategies to help with pain control. Here are 4 things you can try. The first, of course, is medication, and this will be prescribed by the doctor. Another option is ice. You will want to ice for 20 to 30 minutes at a time. After you take the ice off of your hip or knee, you want to not ice for at least another hour, meaning take a break from the ice. You can ice throughout the day using this technique. A third option to try for pain control is some sort of activity. We recommend changing positions throughout the day. For example, when you wake up in the morning, you can sit at the kitchen table for coffee and breakfast. After that, maybe walk a few laps around your house and then rest on the recliner or sofa. The activity can just be getting up to go to the bathroom or moving from your recliner to the sofa. We recommend changing positions every hour. The 4th strategy on the list is breathing. As I mentioned in the beginning, you will have an opportunity to watch a video on management and treatment of pain. This will explain the breathing techniques and exercises. We like to say You are going to make progress from morning to afternoon and day to day. I also like to mention you will make progress from afternoon of surgery to the next morning. If for some reason you have a hard time walking or standing the afternoon of surgery, by the following morning you may be able to walk laps around the nurse's station. Movement and weight bearing promote healing. Your doctor will give us orders to allow you to immediately put as much weight on your surgical leg that you can tolerate. And don't give up. We are here to be your cheerleaders. It will get better. The physical therapist will teach you how to move. Some examples of this will be how to get in and out of bed. It is important for me to mention it will not matter which side of the bed you sleep on. For example, if you always sleep on the right side of the bed and have your surgery on the left leg, it doesn't matter. We will also teach you how to stand up from a chair or from the edge of the bed. If you're having pain or difficulty, you can extend your surgery leg out to ease the pain, which may help with standing. This is especially helpful for the total knee patients. We will teach you how to walk with a walker. A lot of patients ask about crutches, but we start everyone out with a walker. If you want to progress to crutches, just let your therapist know. As mentioned before, we will talk about car transfers and make sure you can do stairs if needed. Let's talk about the walker for a minute. As I said, we will start everyone out with a walker. It isn't that you can't progress to a cane or crutches, but it is the most safe way to begin. We ask that everyone obtains a front-wheeled walker before surgery. This is a walker with 2 wheels on the front and straight legs on the back. It is just like the picture. We ask that you bring your walker to the hospital so your therapist can fit you. In general, when standing next to the walker with your arms at your side, your wrist should be about the height of the handles on the walker. If you don't need the walker to get into the hospital, we recommend you leave it with your family member and have them bring it up to the room after surgery. So how do you get a walker? You will find a list of vendors in the email from the orthopedic coordinator. You can also rent a walker, get one online, borrow it from a friend, family member, or neighbor. Even a few other places to get a walker, either for free or very inexpensive, would be the Goodwill, ask at your local senior center, the Grange, your church or synagogue. If you still can't find one, be sure to tell your physical therapist so we can try to order one for you. Now we're going to talk about exercises. The exercises done before surgery prepares and strengthens the leg for surgery. If able, I want you to start the exercises now, and you will continue them in the hospital and when you go home. And we can tell who has done the exercises before surgery. You will find the exercises in both the electronic version of the notebook sent to you, as well as a separate handout also sent to you. The exercises for the hip and knee are similar, but not exactly the same, so you will want to find the sections specific to your surgery. Now we're going to go over your exercises, and the person doing the exercises for the sake of demonstration is only going to exercise their left leg as if that's their surgery leg. The first exercise are your ankle pumps. This is the exercise that we said earlier you're going to do 10 repetitions every hour that you're awake. This is the only one of the exercises you will do every hour. The next exercise is called quad sets. This exercise is an isometric where you won't see any movement occurring, but you're tightening the muscles on the top of your thighs as if to push your knee down into the bed. The next exercise is called buttock squeeze. And here you're going to tighten your muscles on your bottom. This is an isometric exercise primarily for the total hip patient, but it's fine if you've had your knee replaced to do this exercise as well. The next exercise is called a heel slide. It may be helpful to bend your non-operative leg to support your back. You will now bend and straighten your surgery leg to work on hip or knee range of motion depending on your surgery. The next exercise is called leg slides. If you want to keep the non-operative leg bent to support your back, that is fine. In this exercise, you're going to practice bringing your leg out to the side and back in. This will help you to strengthen the outside of your hip to allow for getting your leg on and off the bed without any help. The next exercise is called a straight leg raise, and this is for the knee patients only. Again, with your non-operative leg bent, you're going to tighten the muscle on the top of your thigh and keep your leg straight and raise your leg up towards the ceiling. Don't be discouraged if you can't do this exercise before surgery or even after surgery. It takes a while to build the strength up. This exercise you're going to be doing sitting in a chair or on the edge of the bed. You will slowly straighten your surgical leg up and down. This exercise works on strengthening the top of your thigh muscle, but it's also helpful for the knee patient to work on their range of motion. So the exercises will be done lying down on the bed or sitting on the edge of the bed or in a chair. At this time, you are not going to want to be getting on and off the floor. You will go through a set of the exercises 2 or 3 times a day, about 10 repetitions. We do ask that you do your ankle pumps every hour you are awake for 10 repetitions. That is the only exercise you will do every hour. Let pain guide your movement. If it's too painful, back off on the repetitions. If you're doing fine, maybe add a few repetitions or do the whole program 3 times per day. On your email from the ortho coordinator, there is a tracking grid that you can use to track your exercises. Thank you for listening to the physical therapy portion, and now you will see the occupational therapy portion regarding your upcoming surgery.
Hi, my name is Johanka, and I'm an occupational therapist at Legacy Meridian Park Hospital. I will be presenting on what an occupational therapist is and what our role will be in your recovery after surgery. Our job is to ask the right questions about your daily routine prior to surgery, and then assessing how your participation in activities of daily living may be impacted after undergoing surgery. These activities may include dressing, bathing, toileting, sexual positioning, tolerating and safely completing transitions such as on and off the toilet, in and out of bed, and in and out of a tub or shower. We are not limited to just these self-care tasks. We also often discuss higher level activities such as pet care, light housekeeping, and resuming leisure activities and work. Our goal is to maximize your safety, comfort, and independence following surgery. Thus, we often make recommendations on how to modify or adapt your daily routine using medical equipment, adjusting how things are placed or positioned in the home, and identifying who your supports are and their availability to assist you when needed. After surgery, you may find that certain positions can cause increased discomfort. In some cases, your surgeon may want you to be more cautious with certain positions, which may impact how you carry out your typical self-care routine. This is where having support or having durable medical equipment is important. For example, putting on socks or shoes may feel uncomfortable or too difficult. Getting on and off the toilet or even managing personal hygiene may be impacted. Some examples of adaptive equipment may include the following: a sock aid, which helps prevent you from having to bend too far forward or stretch to get your socks on. A reacher, which also helps with avoiding trying to bend too far forward if something falls on the floor, but it also acts as a tool that you can use to help get your underwear and pants on. A long-handled sponge, same method, avoiding reaching or stretching too far after surgery, but still maintaining good hygiene. A long-handled shoehorn to help get shoes on. A commode, which elevates the surface of the toilet seat that you're getting up and down from and gives you upper arm supports to help with that process as well. Or if for some reason a bathroom is not closely available to where you're going to be sleeping or spending most of your time, it is also considered a portable toilet. In the same fashion, a raised toilet seat has less of a frame if the space around your toilet is smaller. These come with or without the arm bars, but I do caution you that sometimes they feel a little unstable or people have more difficulty trying to manage their personal hygiene because of the smaller space in the actual toilet seat. For some of you, you may already have taller toilets or what we call comfort height toilets. However, it's sometimes nice to have additional support when getting up and down just to reduce any discomfort in the hip or knee region. This is called a VersaFrame. When showering, you may find that being seated may feel more comfortable or safe. On the left, there is a shower chair. These come with or without arm bars as well. They typically fit in any standard shower, sometimes even in a tub. On the right-hand side, you'll see a tub transfer bench. This helps minimize stepping over the tub, which can be a fall risk. So the idea is that you're sitting and remaining sitting during the duration of your shower or sponge bath to maximize your safety. In this photograph, you may also see that there are grab bars positioned next to the toilet and around the tub shower. These are not necessary, but they are recommended and can be helpful. It is important to make sure that your home or area that you will be recuperating in has clear pathways to safely use a walker, a bathroom is nearby, have handhold supports to improve comfort and safety during toilet and tub shower transfers, making things easily accessible such as in the bathroom or kitchen, and preferably having some kind of chair or recliner or sofa to provide opportunities for staying out of bed. Everyone's experience with surgery is unique, and each surgeon may have certain recommendations for you individually. However, it may be appropriate to consider acquiring some of the medical equipment prior to your surgery for maximal independence, safety, and recovery. Unfortunately, insurance typically does not cover these pieces of equipment, and so we understand that purchasing these tools may not always be affordable. We do our best to assess what your needs will be and can provide you with additional resources where to acquire this medical equipment if deemed helpful or necessary. Again, our goal is to look at how we can maximize your safety, comfort, and independence once you discharge from the hospital to resume your daily tasks. Please don't forget to watch the video link on management and treatment of pain. Thank you so much for your time in watching these videos.